Alright, so we're going to talk about headaches, and because this is a must-know for the Step 2 CS, I've got a mnemonic. It aches. I stole this one, so please check out the link at the bottom of the video. M is for migraines. Know how to make the diagnosis. There's probably a mnemonic. The other M is for meningitis. You probably know this already. I is for intracranial pressure, so things like tumor, pseudotumor cerebri. Just look for the red flags. T, tension headache, is the most common type of headache diagnosed in adults. They're more common in females at the end of the day, and they improve with relaxation or massage. Temporal arteritis, begin treatment with 40 to 60 megs of prednisone prior to getting the biopsy results. That is, if you want to save their vision. AV malformation, prevalence 1 in 1,000, and unfortunately it presents as intracranial bleeding anywhere from 40 to 70% of the time. C is for cluster, more common in males, excruciating unilateral periorbital headache, often during sleep. Now, hypertensive headaches, they're worse upon awakening. The diagnosis can only be confirmed with the diastolic blood pressure greater than 100, often bilateral, often occipital. E is for eyes. It's also for exertional, which occur with straining, coughing, sexual intercourse, things like that. S, sinusitis, which is actually a referred headache, subarachnoid hemorrhage, and finally systemic illnesses, which can be pretty much anything. So here are just a few additional headaches worth mentioning. I already talked about the sinus, but also think about temporomandibular joint headaches, as they can often cause referred pain. I also wanted to mention vascular headaches because it's sort of an outdated term. The IHS stopped using it, but these were any type of headaches that had like a vascular component involved, so clusters, toxic headaches, as well as migraine headaches. So it's also important that we talk about the red flags of headaches. And I know you want the best for your patients, but you also want to avoid litigious situations. Knowing this mnemonic could help you in both regards. S is for systemic symptoms/risk factors. So you're always thinking about cancer, but you also have to think about things like anticoagulation meds, because a lot of your patients are on these drugs and they do cause bleeding. N is for neurological. So these things are pretty obvious, but you have to ask. You should usually always ask about bladder or bowel dysfunction. It's what we were taught. O is for onset, and the other O is for old age. So there's some debate here, but age 40 to 50 with new onset headache is usually not normal. And finally, P, prior headache history. So any change or progression should be a red flag, especially the older the patient.
I'm serious, nigga. What do y'all niggas got to say? Hey, baby. Hey, baby, get some bubble gum in this motherfucker. Right, baby, get some of y'all. Study long, study wrong, nigga.
With so much drama in the LBC, it's kinda hard being Snoop D-O double G. But I somehow, some way, keep coming up with funky ass shit like every single day. May I